Hello to everyone. This is a very good initiative taken by IAPSM West Bengal chapter for our students, undergraduate students. And this series is named as UG Exam Ready series, where we are discussing the respected teachers from all the faculties from the different medical colleges are discussing their semester papers, which will be very useful for the students to appear for their finals. So now with this, Dr. Shinijini Ghosh, Assistant Professor, Rampurhat Government Medical College, will be discussing our semester question paper. So just coming to that. Okay. So this is our paper 1. I will come in details accordingly. Now, first, the question was, what is epidemiology? Classify epidemiological studies, design a study, a suitable study to find out the association between occupational exposure of asbestos and lung carcinoma, and what is the outcome of such study. Mention the advantages and disadvantages of such study. Now, here all we know about all the questions, we know we can get the answer from our textbook, but the most important thing that I would put emphasis on is that in community medicine, don't try to mug up any points without understanding. It should be conception based, and one thing should be very important to all of you, that you should write the answers in points. Give more flow charts, more diagrams, more and highlight the points, the important points. This is a very important tips that I should give to all these students. Read your question carefully and write the answer. So here you will give the definition of epidemiology, and for classification, all of us know observational studies and the cross-sectional studies, in which the experimental studies, in which we are getting the two divisions, descriptive analytical and randomized control trial and non-randomized control trials. Next come what is the study design that we will do for asbestos and lung carcinoma. It is case control study. And why it is case control study? Because it is more suitable, rapid and feasible design here, as it has a long latency period of 15 to 30 years. Now, what are the advantages and disadvantages of this study? This you have in your textbook of Park's textbook, and this I must tell to all the students, follow a standard textbook, that is your Park's textbook of community medicine, and from there try to write the definitions, the advantages, disadvantages, all the points, highlight the points from that book only. And the outcome of the study is what are the outcome? It's by the odds ratio. The statistical outcome is odds ratio, and then you will give the formula. And odds ratio measures the strength of association between asbestos exposure and lung carcinoma. This you have to write. So you have to put emphasis on the points that is asked. Okay. Next question, I'm coming to the next question. That is, what is defined in demography? Describe the different stages of demographics transition, and about dependency ratio and demographic bonus. So definition of demography, again, I'm not going in details. You have to give it from the textbook of Park, and the different stages of demographic transition, very well written in your textbook. The high stationary, early expanding, late expanding, low stationary, declining, and you have to give in details. Okay, and whenever you will find any where you can give any diagram, please do that. Okay, diagram highlighting the points will carry better marks. Okay. Now, dependency ratio, coming to that, dependency ratio, you have to give the formula. All of you know the formula by now. And the ratio, what is it? Actually, it is a ratio of the economically dependent age groups, children less than 15 years to and adults more than 65 years, to the economically productive population. And the demographic bonus you will explain. Next, coming to the next part, that is what is the National Family Welfare Program in it, and we have to discuss the merits and the demerits of it. So it is the Mission Parivar Vikash, as you know. It is launched in 146 high fertility districts across 7 high focus states to rapidly increase access to high quality family planning services. And what are the important things in it? The Antara, Chaya, progestin only pills. These are the things. Okay. Now, coming to the next question, that is NTEP. So, NTEP, there are many newer initiatives in NTEP. You have to read NTEP very well because it is a very important question for your exams. So here in our semester, the question was, how will you diagnose a case presenting with cough more than 2 weeks, fever and hemoptysis according to NTP guideline? So here I must tell you that you should give the algorithmic diagram. Okay, that is must. Okay, you should give it in an algorithm. And then next comes, what are the 4 drugs to treat the condition drug-sensitive tuberculosis? So all of us know that is 4 drugs: isoniazid, rifampicin, pyrazinamide, ethambutol. And for the intensive phase, it is 2 months of intensive phase, that is HRZE, and 4 months of continuation phase, that is HRE, where we are not having the pyrazinamide. And what are the 4, if the question is asked for newer initiatives under NTP, then obviously Nikshay portal you will write, Nikshay Poshan Yojana, and universal drug susceptibility testing, very important point, and tuberculosis preventive treatment. Okay, so these are the points that you have to go through and you have to write. Next question was, what is bridge population? Now, another thing before coming to this, I would say you that in all of you know that your questions, you have to answer all the questions. No or no choices given. And the group A consists of 2 questions of 15 marks. And now group B that I am discussing, it is 10 marks each, and 3 questions will be there. Then group C, where short notes are given, and group D, where explain why or answer with reasonings are given. So this is, and next part you have your MCQs. So here, all of you, that you have to know one thing, that so many divisions of marks are there. So you have to be very to the point. Don't elaborate your answers, because as our respected secretary madam has told in the previous session, that we don't weigh our copies. We see how much the students know and how much up to the point they are, whether they can write the basic conception or not. And for that, I am telling you to highlight the points. Okay. And always one thing that I get very commonly while checking the copies, that students are not writing the question numbers properly. This is horrible if you don't write the question number properly. So a part of the question you are writing here, another part you are writing 2 questions later. But you have to, you should not do this. You have to answer accordingly, and you have to give your question numbers, and accordingly you have to do the paragraphs and write. These all of us know by now, but still we find so many these small mistakes which are actually becomes large for scoring marks. So these becomes large mistakes actually. Okay, now coming to bridge population of HIV. So what is breech population? Define breech population. We know what is it. And what are the modes of HIV transmission? Sexual transmission, parental transmission, and perinatal or vertical transmission. Now, and for bridge population, examples are long distance truck drivers, seasonal migrant workers, and the clients of sex workers. Next, how to prevent? What are the strategies? So It is discuss the different strategies of prevention. For that, you have to give targeted intervention for the high risk groups, prevention of parent to child transmission, blood safety and post exposure prophylaxis, and IC and stigma reduction. Social stigma is to be reduced. Now, the next question in part B only, which carries 10 marks. That is, what are the different levels of prevention, and enumerate the modes of intervention at each level of prevention and describe the levels of prevention and interventions in context of hypertension. A very important question and a very easy question also. So, what are the levels of prevention? All of us know the 4 levels, and in it you have to write the modes of intervention. That is primordial prevention. When you are writing, you have to write modes of intervention. What are they? Mass health education, national health policy, encouraging healthy lifestyles. Primary prevention, what are the modes of intervention? Health promotion and specific protection. You have to write primordial prevention, all the levels of prevention in details, and you have to give the modes of intervention accordingly. Secondary prevention, I'm just telling you about the modes of intervention there also: early diagnosis and prompt treatment. And tertiary prevention, that is disability limitation and rehabilitation. Now, next comes the next part, that is for in context of hypertension. So, how we have to do it? So, first you have to maintain the normal body weight. You have to promote the physical activity, reduce the dietary salt, and discourage smoking and any alcohol intake in youth. So primary, secondary, tertiary, you will divide it in that way. And primordial, I have discussed. So primary, what you have to do: high risk strategy, you have to targeted lifestyle modification, media campaignings should be done. Secondary prevention, you will divide in 2 parts: early diagnosis and prompt treatment. In early diagnosis, you will write opportunistic screening at health centers, and in prompt treatment, you will write about the antihypertensive drug therapy. Now, you may mention some of the some names of the drug, but no trade names, please. Now, you can write telmisartan, then ACE inhibitors. You may write beta blockers, to be more specific. And tertiary prevention, also rehabilitation, that is cardiac rehabilitation, post-MI, physical or occupational therapy post-stroke. Next, coming to group C, that contains the short notes. Short notes contains 5 marks, and 2 questions were given here. So one question was barriers of communication, and the other question was standard normal curve. So what is standard normal curve? You have to give the definition and the characteristic features, and you have to write about the area properties. Okay. Now, next, coming to the answer with reasoning, containing 4 marks each, and 5 questions were given. First was residual chlorine in drinking water is essential in municipality water supply. So here what you have to say: reasoning and mechanism, that is chlorination does what? It destroys the pathogenic bacteria and viruses during primary water treatment in municipal plants, and the water travels through long distributions, therefore giving to negative pressure, cross connections, or unclean storage tanks. Role of free residual chlorine: it serves as an instant chemical indicator, and it maintains a minimum free residual chlorine level of 0.5 milligram per liter after 30 minutes. Okay. Now, so here in every part, what I should tell you again and again is write your answers to the point, highlight your answers with underline the main features, main points, and give diagrams whenever you can. You don't have to give much diagram in community medicine, but what I'm trying to tell you is flowcharts, algorithms, these you have to give. Okay. Next, the question was weakest point in chain of transmission is mainstay of prevention for rabies and COVID-19. See, the chain of transmission concept you have to tell first. That is agent to reservoir, then to portal of exit, then to mode of transmission, after that portal of entry, and then susceptible host. This first you have to write about this concept. Then how it is applied in rabies, that is weakest links, vector or reservoir stray dogs, and susceptible host immunity. And it is a dead end infection, you have to tell that. It breaks the reservoir transmission, post-exposure prophylaxis, you have to say. And application in COVID-19, the respiratory droplet transmission and host susceptibility, and the interventions like masks, physical distancing, ventilation, disrupt droplet transmission, mass vaccination builds protective herd immunity. Next question was, on-site segregation is essential to prevent health hazards from biomedical wastes. Okay, so here also you have to write about the immediate segregation. You have to prevent the transmission of bloodborne infections, and you have to ensure appropriate eco-friendly treatment. Next, coming to the noise-induced hearing loss. Many students could not understand in our college what is the full form of the abbreviation NIHL as it is used in the question paper. NIHL is a preventable condition in community. So yes, it is, because engineering controls is to be done, administrative controls to be done, then personal protection should be there, surveillance should be made. Okay. Next, coming to elderly people are more vulnerable to malnutrition and morbidity. Yes, definitely, because reduced BMR happens, loss of teeth, senility, reduced gastric secretions, more morbidity load, and psychosocial factors are also there. Immunescence is an important thing. What is immunescence? It is age-related decline in the immune function. Okay. So this is all about paper 1, and then you have your MCQs. Okay. And next, coming to paper 2 of our Rampurhat Medical College semester. So here, as you can see, again, there are 2 questions of 15 marks, Group A and Group B. Again, the same pattern of paper 1 also. Here also, Group B contains 3 questions of 10 marks each. Group C again 2 short notes, and again after that answer with reasoning. Okay. Next, what are classify nutrients, what you will do for family visits, how you are assessing. Mention 2 scales, write in brief the recommendations you give to the children and adolescents for anemia following national guidelines. So classify nutrients, all of us know. Socioeconomic status, you can write about modified Parekh scale, BG Prasad scale. These you can write. And how to do the assessment, all of us know. Anthropometric measurements, clinical examination for deficiency signs, dietary assessment methods, and biopathological laboratory assessments. Okay. Now, Anemia Mukt Bharat, it is mainly for that reason this question, next part is given. So, prophylactic iron and folic acid dosing schedule. Some of my some of my students have written the answer. They have written this, they have, I don't know why they have done this. They have given the dose of pregnancy, okay, pregnant women taking iron and folic acid. So be very careful in the dosage. This dose you have to write properly, go through it, and then deworming and dietary interventions you have to do. Biannual deworming, food fortification, that is PM portion, and behavioral guidance. Okay. You should go through all these questions of all the semesters of all the medical colleges very carefully, and you should try to find out the answers. Write the answers from a standard textbook, Park's textbook of community medicine, okay, and give properly, highlight the points. Next, what are the primary health care? maternal mortality ratio. Enumerate the causes of maternal mortality ratio as BMOH, how you will plan to reduce it, and PMSMA, and first referral unit. So maternal mortality ratio, will write the definition. You should give the formula definitely, and like it has been given, and direct, what are the causes, direct, indirect, you will give, and as a PMOH what you should do. This, in these questions also try to highlight the points, write in details, but always highlight the points. Like number 1, strengthen the ANC, antenatal is and early registration, institutional delivery and emergency obstetric care. Third, maternal death surveillance and response. And fourth is the postnatal care and family planning. Okay. Next comes PMSMA, Pradhan Mantri Surakshit Matritva Yojana, Avijan. Okay, so a flagship initiative providing fixed day free comprehensive ANC services to all the pregnant women on the 9th of every month. And it focuses on the routine lab examinations, doctor-led clinical examinations, high-risk pregnancy identification and tagging. And next question was about the first referral unit. So 4 important criteria, what are they? We always search for these 4 important criteria of FRU, these 4. There are these four important criteria: 24-hour emergency surgical obstetric services, 24-hour newborn care and sick newborn care unit, 24-hour blood storage facility, blood bank, and round-the-clock availability of specialist manpower. These questions are very important. Okay, you must go through these questions properly. Next comes the third question, that is in group B. Now, what are the principles of health education applied to NCD prevention? So principles: credibility, participation and active involvement, comprehension and motivation, reinforcement learning by doing, and sour soil said. So this is the points that I am giving to you. You should develop the points. You should develop the answer with those points. Next question was the question of what is the difference between health education and health propaganda. So, what is the difference between health education and health propaganda? So, health education is, the aim is to educate, empower and build self-resilience. How it is done? Two-way communication, encourages questioning, active participation. Okay, process is slow, long-lasting behavioral change, appeals to reason, logic and scientific facts, thinking, logical thinking, and focus on the individual and community health interest. But what is health propaganda? It is, the aim is to instill specific rigid beliefs or impose in opinions without reflection, and it is a one-way communication. Okay, it discourages questioning and critical analysis, appeals to emotion, fear, bias and blind faith, sponsors or organizations' interests is important, and the process is rapid, temporary compliance driven by emotional impulse or force. Next comes, what is ergonomics, the occupational health hazards. Ergonomics, the definition should be given from textbook, and health hazards you will describe. And ESI Act, a very important thing. ESI Act is also very well written in your book, and you should give the points, the important points, like exemption from Workmen's Compensation Act, exemption from Maternity Benefit Act, tax reduction. These things you have to give emphasis. Next comes, define the primary health care, and for that you should give the definition. What are the 4 principles? You should discuss the principles. This is a very important Viva question also. What are the 4 principles of PHC? Anywhere you can get this, and by now all of you students, I hope you know: equitable distribution, community participation, intersectoral coordination and appropriate technology. right? Now, next is what are the health and wellness centers, that is Ayushman Arogya Mandir. This you have to do in details, write in details. And next comes the short note on behavior change communication. Behavior change communication, you have to write the key points, that is how it is done, what are the strategic designs that is done, and how to evaluate. Okay, and you just give an example. Say for example, exclusive breastfeeding promotion, or vaccine hesitancy reduction. Okay, now next is the very important ICDS beneficiaries and services provided. So beneficiaries, three beneficiaries you should discuss, and the 6 core services. Okay. Now coming to the reasoning part. Mental illness is preceded by various warning signs. Elaborate. So here you have to write, you have to give the early warning signs like behavioral changes, emotional symptoms, cognitive or perceptual changes, and vegetative signs. Next, judicial use of social assistance will be beneficial or society at large. So this here, it prevents the catastrophic health expenditure. It promotes equity and social justice, prevents dependency syndrome, enhances population health indicators. And next question was about the census. It is an important primary source of health information. Definitely it is. You have to discuss about the census, by how many years we get the census, what are the different indicators that we get from the census. This you have to discuss. And next comes the quantitative management techniques have a great role in health services. Yes, like for network analysis, PERT, program evaluation and review technique, this, and cost effective and cost benefit analysis. These two. In short, you have to give. Next, last question, HIV as a behavioral disease. Definitely HIV is a behavioral disease. Why? Because behavioral transmission takes place and the public health implications you have to write. Now, this contains the paper 1, this and paper 2 of our semester of Rampurhat Government Medical College. And here I must tell to all the students that you should go, number 1, you should go through your question paper at first very carefully. You should write the question numbers properly before answering them. You should write answers in points, and then you have to elaborate, highlight the points, give the headings, use diagrams, flow charts wherever you can. Like if you have a question on iceberg phenomenon, you should give a diagram. If you have a question on NTEP, you should give a flow chart. How to diagnose tuberculosis, you should give a flow chart. So always use these things to uh, do it properly. And a very important thing is, don't write too much, give to the point answers, because you should lack your time later on. If you write one answer so much and give so many unimportant points, don't do that. And all the questions nowadays have very many parts. Go write those parts in proper paragraphs so that your teacher who is marking the answers will not miss any question. You should do that. You should make sure that you are giving the answers in properly in paragraphs. And you should attempt one thing I must tell you, I tell all my students, you should attempt all the questions, okay? If maybe you haven't, you have gone through it before, but you haven't gone through it the day before the exam, but you are not attempting the question, don't do that. Answer all the questions. So this is all about this. And another thing is that, one thing I should tell you, that all my best wishes to all the students, all the students appearing for the exam. And I thank to the IAPSM West Bengal chapter for giving me this opportunity to discuss these questions and answers with my dear students. Thank you so much.